Hi, I'm Dr. Paul Petrangero, and I represent Get Done in One in the Chicagoland area, and I'm the owner of Start Smiling Dental Implant Centers in the Chicagoland area as well. I would like to take a few minutes with you as a patient and describe some of the things that I think are very misleading to you from dental implant centers in their advertisements that they play on TV and on the radio and in the newspapers. And I think it's really a shame that the consumer doesn't fully understand these procedures before they commit to them, because in my practice, 30% of my practice is fixing implant failures and complications. 30%. And a lot of these people, it's failure within the first 1 or 2 years after they're completed with their treatments, with tooth replacement procedures. And these procedures are not inexpensive to have done. So what I want to do is talk about a new technique that I am the only one doing in the Chicagoland area, and how it's revolutionizing how we do immediate tooth replacement for patients looking to replace their dentures or replace their missing teeth or decayed teeth or complicated teeth with a beautiful set of natural looking and natural functioning implant supported teeth. Well, there's two things that we have to first of all describe what this procedure is. The procedure is technically called an all-on-4 dental implant replacement. Now, what does this mean, all-on-4? An all-on-4 means is that if you have no teeth or you're removing your teeth, they place 4 implants in each jaw. So the implants are placed kind of at an angle in the back and then 2 straights in the front. Now, why is this? Well, there's a couple of reasons. One of the reasons, if you can look at this schematic of this model, okay? One of the reasons is that imagine a bridge, imagine a construction project. And if you have a long bridge and you have one of the piers here and then way down there you have another pier, what happens to the middle of the bridge? It sags. But if you put a couple piers in the middle, now you've got a strong, even balanced bridge. So by putting the implants further apart and by angling them on your top jaw, angling them from here, they're trying to avoid your sinus. Or on the lower jaw, angling it from here, they're trying to avoid a nerve that comes to here and then exits out into your tissue. And we're all built like this anatomically. And by doing that, they're increasing the distance between each one of the implants so that they're spreading this out a little bit. Now, this is a procedure, this all-on-4, that is sold as immediate tooth replacement, teeth in a day, smile forever. Matter of fact, it's such a marketing ploy that one of the all-on-4 centers in Chicago took my moniker, okay? My company is called Start Smiling Dental Implant Centers. And they say in their advertisements, start smiling again, which is my moniker. It's kind of flattering that they would take that from me because that's what we do. But that's okay. We're educating, and I'm here to educate and here to make sure the consumer understands what they're getting, okay? Now, this all-on-4, all right? Your final teeth, when you get this all-on-4, are plastic. They are denture teeth, okay? Denture teeth. So if you have dentures and you want something more stable, you may want something that's different than denture teeth. Now, denture teeth are good. In today's day and age, 2019, the companies have made all kinds of beautiful advancements with acrylic teeth. However, they're not customized. They're stock. The colors are stock, the shapes are stock. And the flanges that go up into your tissue or in by your palate or your tongue are plastic, okay? This process also, they bill it as Smile Tomorrow or Smile Meeting. This is a 6 to 8 month process. And the first surgery is very aggressive because when you're dealing with plastic teeth, which I'll show you in a few minutes, you have to have a certain thickness of the plastic so that the plastic doesn't break. So what they do is they reduce your bone. The surgeon reduces your bone. And there's measurements that they take. Now we go back to failures. A lot of the people that I've had to take over from these centers, they've had premature failure of their upper all-on-4 implant prosthesis. And because so much bone was reduced in this procedure, they don't have any bone left to do implants the right way. I have to go to the cheekbone, which are called zygomatic implants. I have to go up the sides of the nose, which is called the lateral piriform plate. I have to go into the middle of the nose to try to get some areas of bone because it's very, very complex and almost impossible to graft the bone back in these situations. And that's a really problem because there's a lot of younger individuals in their 40s, in their 50s that are getting these procedures done. And what do they do if there's a complication or this doesn't last 10 or 15 years? One of the companies used to have a lifetime guarantee that they pulled off because they couldn't stand behind the work because they were failing faster. Now, let's talk about what I do differently and what Get Done in One does differently. This procedure is now not 4 implants, it's 6. Imagine a chair that has 4 legs. Famous saying from one of our founders of the implant field that we have today, and he was against these procedures. And his saying was, imagine if you have one leg fall off your chair, what happens to the chair? It wobbles. So imagine if we have 6 implants and one implant should have a complication or problem. Does that mean that the chair is going to wobble? It's a poor analogy, but still it gives you the idea of what we're talking about. So we're having 6 implants now. Here's the big difference. Your final teeth are not denture teeth or acrylic. They are a nanoceramic, more or less porcelain would be more that what we would understand. A nanoceramic, okay? What does that mean? That means that it's harder, okay? That means that you can use less material because the material is harder. You don't have to worry for the tolerances of the material to break or crack or chip. And if it does, because it's a nanoceramic, small particle, you can repair it. If the denture breaks, it's a separate procedure. You have to take it out, you have to send it to the lab, they have to bring it back. And if they have an on-site lab, which most of them do, you're in a chair for hours. And once that plastic breaks, there's now stress fracture points in the material and a tendency for it to happen again. And they have to make it thicker and bulkier. This is very thin and streamlined. I'm going to show you examples in a few minutes. Okay? But more importantly, because it's a nanoceramic and there's less material required for thickness of the prosthesis, which I'll show you, there's much less bone reduction, minimal bone reduction. And what does that mean? We're not taking your bone away to have 4 implants, okay? We're not taking this much bone away in your upper jaw, okay? When this procedure is done from your CAT scan, hopefully they're taking a CAT scan, from the edge of where your tooth is gonna be to where your bone has to be reduced to allow for the proper thickness of the plastic so it doesn't break is 18 millimeters. That is this much. That's how much room has to be there. So from here to here is where the bone has to be reduced. And this is in textbooks. This is in articles published. This has been taught all over the world. This is the technique. Now, oftentimes the surgeon, hopefully conservative, takes less than that, but then we have problems with breakage of the teeth, loss of the implants from overload. In this procedure, okay, we need much less. We need maybe from where this is, the normal length of your tooth, okay, the tooth itself is probably 15, 18 millimeters. But that doesn't mean we're taking it beyond where your tooth has already lost the bone. So there's much less bone reduction in this procedure. And because of the technology we have in the office with facial recognition scanners and scanners of the materials, meaning digital transformation of what is in your mouth to the lab and milling machines and customization processes, we are able to give you your final teeth, your final nanoceramic teeth in 48 hours. One procedure. 6 to 8 months, 48 hours. Superior material, denture plastic teeth. This is what the consumer needs to beware. This is extremely important, and you need to know your options before you commit to these things. Now, here's the big point. Everybody wants to know, what do implants cost? What do they cost? Well, this procedure, okay, is nationally advertised around $24,000 per jaw, upper jaw, lower jaw. That's the surgery, that's your temporary denture day one, that's probably your CAT scan, hopefully, free consultation, then the 6 to 8 months of maintenance and monitoring if there's no problems or complications, then another 2 months to make your final teeth, and that's what you're going to pay. Maybe they reduce the price a little bit to try to get you to say yes to the treatment or whichever. That could all be possible. Get Done in One per jaw is $22,500. So your prices now are cheaper. Your wear and tear on your time, which is very valuable to everybody, we can't get time back, is a fraction. The materials are not even close to where they're at. Plus, we're giving you more implants at the same time. So this is something that I believe is so important to the consumer that they have to know. 2 examples of what these materials are, okay? So this is and all on 5 on the upper because there was a lot of bone loss, and an all on 4 on the lower. So if you can imagine now, this goes in like this, and this one goes in like this, okay? So imagine this much material on the floor of your mouth where your tongue is. Imagine speaking with that or feeling that much material was there all day long. Imagine this much material on your palate, up in here. And look at now this is an all on 4 still, 4 implants, but now with the nanoceramics, because I refuse to stop doing these for patients. But we do these with 6 implants depending on bone structure and everything that's there. Look at how thin this is on the palate. Look at how thin this is by the floor of the mouth. More like natural teeth. Additionally, let's take a look here, all right, at the aesthetics of the nanoceramic versus the denture acrylic. This is the nanoceramic. Now I ask you, which would you prefer? The acrylic, all on 4, denture teeth, stock teeth, limited numbers of shapes, colors, and sizes? Or do you prefer the all on 6 nanoceramic, beautiful aesthetics, harder material, infinite number of options of shades and colors to match your facial profile, your eye color, and everything that goes with your smile, thinner, what we call flanges on the insides of these procedures, and a much higher aesthetics at a less expensive rate when it comes down to the price, your time, your investment, and everything that you have to do, your bone loss, the bone amount that they're going to reduce. This is, in my opinion, not even a close decision. I believe in having people understand their options, and I believe that not one particular procedure matches all patients that come in to see us for tooth replacement procedures. So I'm going to take this opportunity to say thank you for your time. I hope that you've enjoyed this video. I know I have a tendency to ramble on, but I'm very passionate about what I do, and the buck stops with me. When you come in, you see me for the consultation, not a treatment coordinator. And I've had patients come in for second and third opinions, and they very rarely will leave without having us do the procedure. This is, as they say, the tell of the tape. And the consumer, again, really needs to understand why this procedure is here and what we are doing differently. We have locations in Northfield, in Schaumburg, and in Lamont. And we are here to help you, and we are here to take care of you, and we stand behind our work. Thank you for your time, and I hope that I see you to review your case with you and talk to you about your options. Thank you.